When you're managing a chronic illness like inflammatory bowel disease, what's the one question you always get? It's, how are you feeling? But what if I told you that for millions of people, that's actually the wrong question? Today, we're going to dive into this really strange and super important disconnect between how you feel and what's really going on inside your body with IBD. And this isn't just a theory. This question, which was inspired by a real online discussion between patients, gets right to the heart of the problem. People are seeing it with their own eyes, their blood tests aren't matching up with their symptoms, and that creates a ton of confusion and, frankly, anxiety about how to manage their health. So, this is the big question we're tackling today. When the problem, the inflammation, is happening deep inside your gut, can you really trust your outward feelings, or even a lack of them, to be a reliable guide? Let's dig in and find out. All right, so our story really starts with the central challenge of IBD. It's a hidden disease. It's this internal battle that can completely fly under the radar of our own perception. Okay, first, just a quick refresher for everyone. Inflammatory bowel disease, or IBD, isn't just, a bad stomach bug that goes away. It's a group of chronic conditions, like Crohn's disease and ulcerative colitis, where your own immune system basically gets confused and attacks your gut, causing this persistent, ongoing inflammation. And this is where that critical gap appears. On the one hand, you have the patient's experience. They might feel totally fine, no pain, no running to the bathroom, life feels pretty normal. But on the other hand, you have the biological reality. Inside their gut, that inflammation can be silently simmering away, causing progressive and sometimes irreversible damage. So how do we spot this hidden damage? Well, the best tool we have is an endoscopy, what doctors call the gold standard. But let's be real, you can't have a camera put into your gut every few weeks. It's invasive, it's expensive, and it's just not a practical way to keep tabs on things. We need a better way. And that, of course, brings us to the next chapter. If we can't always look inside, maybe we can find clues that leak out. And this is the incredible promise of biomarkers. Think about it like this. Your car has a check engine light, right? It tells you something's wrong under the hood, even if the car seems to be driving just fine. Well, biomarkers are basically the biological version of that. They're signals we can measure in your blood or stool that can alert you to a problem on the inside. So how does this actually work? Well, when the lining of your gut gets inflamed, it's not a quiet event. The immune cells involved release this whole cascade of specific proteins. And these proteins, these little messengers, they seep out of the gut wall and make their way into the bloodstream and, you guessed it, into your stool. It really is a pretty simple three-step process. First, you've got inflammation happening in the gut. Second, that inflammation releases those telltale proteins, the biomarkers. And third, we can then measure them with simple, non-invasive blood and stool tests. And in the world of IBD, there are four main players we're looking for. In your blood, there's C-reactive protein, or CRP, and the erythrocyte sedimentation rate, or ESR. Then in the stool, we look for fecal calprotectin and fecal lactoferrin. Sounds like a pretty straightforward solution, right? Just run the tests. Well, it's not quite that easy. And this brings us to our first real complication. It turns out that these check engine lights aren't all created equal. Some are way more reliable than others. Let's start with those common blood tests, CRP and ESR. They're used all the time because they're easy to do, but they have one massive limitation. They are totally non-specific. They'll tell you that there's inflammation somewhere in your body, but they can't tell you if it's from your Crohn's, a simple head cold, or even a stubbed toe. A stool test like fecal calprotectin, on the other hand, is a whole different ballgame. It's much more specific. Since it's measuring a protein that comes directly from the inflamed intestinal lining, a high level points a big flashing arrow right at trouble in the gut. It's like having a sensor right at the source of the problem. And the difference in accuracy is, well, it's dramatic. A large analysis showed that fecal calprotectin has an 88% sensitivity for detecting active disease. That means it gets it right 88% of the time. Now compare that to CRP, that common blood test, which has a sensitivity of only 49%. It misses active disease more than half the time. So the key takeaway here is pretty clear. When it comes to finding that hidden silent inflammation, a stool test like fecal calprotectin is just way more reliable than the common blood tests. Case closed, right? Not so fast. The story actually gets even weirder. And now for the big plot twist. We've established that stool tests are better than blood tests. But it turns out, in some specific cases, blood tests aren't just less accurate, they can be actively and dangerously misleading. This whole twist centers on Crohn's disease. See, unlike ulcerative colitis, which only affects the large intestine, Crohn's can pop up anywhere in the GI tract, including that long winding small bowel. And when the disease is mostly in the small bowel, something really bizarre happens with those blood tests. A landmark study way back in 1990 found that for patients with Crohn's disease in their small bowel, there was an inverse correlation between their disease activity and the ESR blood test. Now let that sink in for a second. An inverse correlation means that as the disease got worse, the inflammation marker in their blood actually went down. The sicker the patient became, the healthier their blood test looked. It's completely backward. So where does all of this leave us? We've got a hidden disease, symptoms we can't always trust, and markers that can sometimes straight up lie to us. This all leads to the new frontier of managing IBD, treating the disease that you can't see or feel. And there's actually a name for this whole phenomenon. It's called silent Crohn's disease. It's the official term for everything we've been talking about, a state where a patient reports feeling perfectly fine, but objective tests show that inflammation is actively causing damage inside their body. And the stakes for ignoring this silent disease, they are incredibly high. Research from the University of Pittsburgh looked at patients who felt perfectly fine, but those who had elevated inflammation markers had a staggering 37% risk of being hospitalized for a complication within the next 2 years. Now compare that to the other group of patients. They also felt perfectly fine, but their inflammation markers were normal. Their risk of hospitalization was only 7%. The difference is huge. This just shows you the power of that objective data. That silent inflammation was a ticking time bomb, and the biomarkers were the only warning sign.